lines, drawn the valleys and the hills, and then decide exactly where I am going to inject and what I am going to inject. And then I would block with the border of my dorsal aesthetic line, and then I will inject in the area that I marked. So it's very important, the plan. Multiple, very little, very little.
Or just one.
No volume injection. So you go and a little bit up, a little bit down, from one injection point. Yes, but not injecting area. You have to keep moving and trying to put little aliquots in different parts of the area you're injecting.
On the tip.
Again, depending. So if I want to highlight the two tip reflex, so then I go sometimes, depending on my map, I have to have planned it first, make sure that, if it's a droopy like that, so then I have to inject below so that this will come up.
Okay.
Yeah. So and with that, I usually approach it from here, or as Dr. Ejikimi said, we can come from the supratip area. We can come from the supratip area through the domes, and then we are here really kind of just under the dermis. So here in the midline you are okay, but you inject very, very little, and then slowly you build this area, and then you keep looking at the profile, and then you can come in between the crura here and carry on your work to support more cephalad. Here in between the cartilages. So through the skin.
How many?
Through the skin, because here you can feel it. You can just put it on yourself. When you put and then you move, you feel the groove between the two. Yeah. So you just feel there in the groove in order to get that. But then finally, the definition of the two reflection points, you will have to draw the two dorsal lines, and where they are, you have to augment it each one. But again, in the subcutaneous area. But very, very conservative, very little. I wouldn't discuss like the product, but usually in the tip I use a soft product, and in the dorsum I use very hard product. So highly cross-linked, less cross-linked. Do you understand? I don't use hard product around the tip. No, always soft. Even if I have to change after 12 months, it's fine. So hard product around the bony landmark. In the tip I don't put, because if you make mistake, you will have a lump there. And then you have to like treat the lump or something. I like to to kind of medium. I don't want you don't put like something like water there for using for mesotherapy or hydration. Yeah, but I don't use a very hard product around the tip.
And here.
Yep.
To push.
Yes.
Now.
Yeah. You just augment multiple 1, 2, 3, 4, 5, like you do.
Okay.
For
also
the
superstition.
No, in between the crura. You have the medial crura there, and there is a groove in the middle of them. Yeah. So you can just augment that. Yes. There is a columnar artery there. You need to be super careful.
Yeah.
Because there is the columnar artery, which is a branch of the superior labial artery. It just goes there. Two of them. So I go always in the midline.
In the middle.
Yes. Okay.
And you have luck not to have anatomic variation.
I use. Of course, you have to be. I'm a rhinoplasty surgeon, so I can analyze. I know exactly. You need to be very, very confident with the anatomy before you are able to work with the nose. You need to see the structure and feel them and know exactly where the lower lateral cartilage, crura are going and moving. You need to read topography very, very accurately.
Do you need ultrasound? Your colleague
Yeah, we are working on research.
mapping with ultrasound.
Yes, well, it's not very useful, but you can look for ultrasound around the facial artery, the big ones.
Okay.
Yeah, you can, but I don't use it. It's research. Yeah, of course. Yeah, you can.
Thank you.